So Vox is a media outlet that I've criticized in the past. They're policy wonks, which I think is a good thing, but they're also very incrementalist in their nature. Now, I think they would probably deny that, but I also think the evidence for that is overwhelming. So they were, more on Team Hillary than Team Bernie during the primary and all that stuff, which is, I think, when they lost a lot of people who really held them up to a high standard. But at least on one issue here, it looks like they did some great work. So here's Ezra Klein of Vox learning about the wonder that is Medicare for All single-payer healthcare system.
I cannot tell you how obsessed I am with this chart. It shows exactly what is wrong with America's conversation about healthcare. On one level, you've seen this chart before. It shows healthcare spending as a share of the economy of a bunch of countries. There's Germany and France and Japan and Canada, and oh, there's America. But now I want to add something you haven't seen to this chart. This is how much of that spending in each country is private and how much is public. Here's what's amazing. America's government spending on healthcare, on programs like Medicaid and Medicare and the VA, our versions of socialized medicine, it's about the same size as these other countries. These countries where the government runs the whole healthcare system. And then there's our private spending. It's the private insurance system that makes healthcare in America so expensive. Conventional wisdom says the government is more expensive than the private sector. It can't say no, it's corrupt, it's inefficient, it's slow. You want something done right, you give it to the private sector. That is what we hear in America all the time. And yet here we are with the biggest private sector spending the most. Why is a free market so bad at controlling the cost of healthcare in the United States? If you look at the data on physician visits and hospital discharges, you can get rid of one theory. Americans don't consume more healthcare than people in these other countries. We don't go to the doctor more than the Germans or the Japanese. In fact, we go to the doctor less. The difference between us and them is that we pay more. Every time we go to the doctor for everything from an angioplasty to a hip replacement, from a C-section to a pain reliever, in America, the price for the same procedure at the same hospital, it varies enormously depending on who is footing the bill. The price for someone with public insurance, like Medicare or Medicaid, is often the lowest price. These groups, they cover so many people that the government can demand lower prices from hospitals and doctors, and they get those lower prices. If the doctors and hospitals say no, they lose a ton of business. They lose all those people on Medicare, all those people on Medicaid. But there are hundreds of private insurance companies, and they each cover far fewer people than a Medicare or a Medicaid. And each one has to negotiate prices with hospitals and doctors on their own. And if you're uninsured, you have even less leverage. Nobody is negotiating on your behalf, so you end up paying the highest price. One study found that most hospitals charge uninsured patients 4 times as much as Medicare patients for an ER visit. Other countries, they don't have this problem. Instead of every private insurance company negotiating with every healthcare provider, there's just this big list. Country, the central government, they go and they say, if you want to sell to us, to all of our people, then here's what you can charge for a checkup. Here's what you can charge for an MRI or a prescription for Lipitor. And so then whether that bill goes to the heavily regulated private insurance companies in Germany or directly to the government like in the UK, each country is telling the doctor or hospital or drug company how much that bill will be. And because the government controls access to all of the customers, it's an offer that hospitals and doctors and pharmaceutical companies typically can't refuse.
I'm gonna make him an offer he can't refuse.
In America, the idea is that you'll be a consumer, that you'll do what you do when you go to Best Buy and buy a television. But that just doesn't work in healthcare. It doesn't work in healthcare because you often come and get healthcare when you're unconscious in an ambulance, when you're scared, when it's for your spouse or your child. It is a time when you have the least bargaining power. You are not usually capable of saying no. You're not knowledgeable enough to do it, you're not comfortable doing it, or you're not conscious enough to do it. That's why in other countries, the government is a person who can say no for you, who can say, no, that's too expensive, you're gonna have to lower your price, because they do have that power.
That was a very, very good job from Ezra Klein there. He explains it in detail. You know, what's so interesting about the healthcare debate, so-called debate, is how much it is not debatable, but we still debate it. And what I mean by that is, it's like we have the answers are in. We have the answers. There's no question about that. It's just, there's this giant movement to obfuscate and deflect and dodge and smear in the discussion coming from the right, and unfortunately from corporate Democrats as well. Some corporate Democrats, but 61% of the country says, hey, we want Medicare for all, even with the giant propaganda effort from health insurance companies and Republicans trying to tar it and act like, nah, that'll lead to fucking waiting lines and death and terrible things. And all of those points are bullshit. All of them are bullshit. So, for example, when it comes to waiting lines, understand that everybody rations care. There are waiting lines in the U.S., but waiting lines in single-payer countries are for elective procedures. So in other words, they prioritize based on who needs the care immediately in single-payer countries. In the U.S., they don't do it based on need. They do it based on who's rich, who could pay for it. So we have 45,000 people that die every year in the U.S., according to a Harvard study, because they don't have access to basic health care. I mean, that's so wild, and nobody talks about it. They don't have people who die from a lack of basic health care in these single-payer countries. We have hundreds of thousands of medical bankruptcies every year in the U.S. They have zero in single-payer countries. So, and look, every time they've looked into this, the studies come back with the same goddamn result. Whether it's the World Health Organization, whether it's the Commonwealth Fund, I mean, all the studies come back and say the single-payer systems around the world are the best. The U.S. is the worst of every modern nation. We pay more, we cover less people, and look, we have a system that's built on price gouging. You have an unnecessary for-profit middleman. You don't need that middleman. Single payer means there's one insurer, it's the government, and they don't charge you anything extra. There's no profit margin. So by definition, they are price gouging you if you have a private insurance company. And what's interesting is the private insurance companies all got together and they bragged recently, where they said, people don't understand what's really going on with private insurance. Let's explain it. And they released this chart and they show like, okay, here's where all your money's going. And you're supposed to go, oh my God, we were so wrong all along. 80% of the money that goes to private insurance companies goes to healthcare. Here we are thinking that they're spending less on healthcare. No, 80% of the money goes to healthcare. We shouldn't complain. That's $8 out of every $10 that goes to healthcare. And 20%, so $2, so $2 out of every $10 goes to overhead costs. But guess what? Number one, it's only 80% because Obamacare forced them to spend 80% of their money on actual health care. Before that, there were ratios that were like 50-50. Half the money was going to overhead, half the money was going to health care. But furthermore, they undermine their own argument. Because when you look at Medicare, 92% of the money goes to health care. So it's 8% overhead versus 20% overhead. So they think they're making their case. They actually just undermined their case and made the case for Medicare for all. So look, that when the system is geared towards profit, there are some industries where that incentive structure is fucked up and it can't work. Prisons is another one. You can't make it financially profitable to lock up more people because then the private prisons are going to lobby the government to make more things illegal so they can lock up more people. You've now made it something that somebody somewhere wants to lock up more people, whether or not they commit a crime. So you can't have the profit motive in prisons. You can't have it in health insurance. Because then what's going to happen? The way they make more profit and pad the bottom line and make their shareholders happy is when they do what? They deny as much care as possible so they can take more of that money and keep it for themselves. So you've set up a system where people are going to deny care as much as possible. That's lunacy. That's crazy. That's terrible. You can't have that motive in this industry. So final point I'll make here is people say Medicare for all is expensive. We can't do it. It's expensive. It's expensive. They never make that case for endless war. It's expensive. We can't afford that. Nobody ever says that for endless war, for example. Nobody ever says that for the $80 billion a year we give to big banks or Wall Street bailouts. Nobody says it when it's, when it's to help the donors. When it's to help regular people, I can't afford it, or we can't afford it. But, okay, we'll grant them that. It's expensive. Medicare for all is expensive. You know how much it costs? $32 trillion over 10 years. Here's the only problem with that argument. To do our current system and continue this, it costs $49 trillion over 10 years. So in other words, if you scrap our current system and do Medicare for all, we save $17 trillion. I don't want to hear another fucking word about how expensive it is. It saves money. It saves money. So there are no arguments left for a private system. Maybe if you're a super duper rich person, or you're a Saudi prince, something like that. For them, sure, they probably want the private system because they get preferential treatment because they're really fucking rich. But everybody, whether you're poor, middle class, upper middle class, even a regular rich person, not a mega rich person, Medicare for all is the way to go. No question about it. And Ezra Klein did a good job here for Vox making that case.